My name is John Kempton, and I have been passionately advancing the oral systemic health movement in dentistry for the past 3 years. The all too familiar statistics resonate loud and clear. Heart attacks every 34 seconds. Deaths from that heart attack every 60 seconds. 1 in 3 deaths in America come from cardiovascular disease, and that hasn't changed in a long time. Now, for almost 100 years, cardiovascular disease is and has been the #1 killer. So when is enough enough? When does it dawn on John, me, that I could be part of the solution? Well, friends, right here at this desk 3 years ago, our office manager came in the room and said, "Remember Joe? We removed his remaining teeth last week at the request of his cardiologist. You even called his doctor and discussed providing Joe with 4 amoxicillins 1 hour before the appointment." "Yeah, I remember." "Well, Joe died of a heart attack yesterday. His wife just called to cancel his follow-up appointments." Up to this point, I had been aware of oral systemic connections. My awareness could not have possibly been of any value to Joe at this moment. I felt convicted right now to know more and to do more because of this event. Within a week, I had signed up to take part in a one-of-a-kind learning opportunity hosted by the Dawson Institute of Systemic Health. 7 weekends over 7 months of roundtable discussion and research with dentists, periodontists, cardiologists, medical doctors, and a number of other healthcare professionals were around those tables. A few weeks after Joe passed, and before getting into this new curriculum, I had another confirming moment of truth. I went into a treatment room to do a recall exam, like many of you might, for Mrs. Cooper, wife of Dr. Cooper, recently retired local physician. Both of them were on 3-month recall programs, and they always came in together. "Good to see you again, Mrs. Cooper. How is Doctor doing? Did he come with you today?" I'll never forget. She looked me right in the eye and calmly said, "He passed away of a heart attack. I will always be reminded of it when I come to see you. It was just 1 week after his last cleaning that he passed away." Now that about took my breath away. 2 patients in a 2-month time frame had died of a heart attack a week after an invasive dental procedure in our office. It was at our first Oral Systemic Study Club meeting in Nashville that we learned the incidence of cardiovascular events goes up 50% for the first 4 weeks after any invasive dental procedure, and eventually returns to normal after 6 months when the patient comes back to start it all over again. Periodontal disease is a polymicrobial, infectious, systemic, inflammatory disease with genetic expression. Being accountable for the systemic impact of the local high-risk patients is a sobering responsibility. I've dedicated the rest of my professional career to prevent another Joe or Dr. Cooper moment of truth for any of my colleagues. Dentistry is medicine. Dentists, we are the front line of primary care. What we do matters. Please consider join the movement of implementing life-extending clinical practices in your hygiene program now. You and I are the solution to diminish the effect of chronic disease in this country, starting with our patients. Thank you for your time, and I hope to see you soon.